Welcome to Muskegon Rising, a community service project of the Muskegon Rotary Club. Our purpose is to create lasting positive change. We've been doing that here since 1916. So, let's get started.
Good morning. I'm Nancy Crandall, Muskegon Rotarian, and your host for this episode of Muskegon Rising. I'm very pleased today to have as our guest, and we'll have a conversation with Kathy Moore, who is the Executive Director of the Muskegon County Health Department and the person who led this community through some very difficult times during COVID. So, Kathy, you've served as the Public Health Director for many years. What initially drew you to public health, and what has kept you in this work?
Thank you, Nancy. Initially, I was attracted to the Public Health Department because of the variety of programs that was available and an opportunity to serve the public in a different way. I've been a volunteer in the community for years, but that was a volunteer, and I actually always admired our staff and executive leaders of Health and Human Service in Muskegon County, and this was an opportunity for me to work hand in hand with them.
And you are not the traditional health department director.
Yes.
Your background is in finance, right?
Yes. So initially I came in as administrative analyst and finance supervisor, and I got to understand the programs and the funding and how to allocate and leverage county resources, taxpayers' dollars.
Oh, what a good thing.
Yes.
You don't have to have a health background to be public health director.
Yes.
Over your past 10 years as director, how would you describe your biggest public health challenges, both before and after COVID? And how did the pandemic shift priorities?
Thank you. So a couple of challenges. The first for public health is just the public health identity and the public health brand prior to COVID, helping the community understand that we are not medical care, we're not health care, and we're not necessarily poverty health. We have two amazing federally qualified health centers that provide health care services. So we are more work in collaboration and help enforce the Michigan Public Health Code to prevent disease, protect the environment, and promote healthy behaviors. So with that, prior to COVID, our prevalence of STIs or STDs was a little overwhelming for a community our size. And just working with those who were infected or those at high risk of being infected to just understand the communicable nature of STIs.
Just to clarify, STIs.
So STIs is sexually transmitted infections. And prior to that, they were referred to as sexually transmitted diseases. But disease has such a negative connotation. So those two things, just, who is public health prior to COVID and then the STI. And then after COVID, or during COVID, during the pandemic, public health departments just was in the forefront. And people were understanding a little bit more of our enforcement and regulatory duties and responsibilities.
And one of the reasons many people come to the health department is to get vaccinated, particularly if they're traveling or don't have a family care doctor.
Absolutely. So one of our primary roles is really not necessarily treating an individual, but protecting the population. So we will treat an individual to protect the rest of our residents. So when someone travels, we have to look up if there's any prevalent outbreaks or just really communicable diseases that we need to vaccinate an individual for so that they don't bring that geographic concern back to our community.
During the height of the pandemic, public health departments were under immense pressure. What were the most difficult decisions you had to make, and how did you approach those?
So some of the most difficult decisions, because of social media and news during the pandemic, and really hearing about what was going on in major metropolitan areas like New York City or California. So when rules and things changed at that level, we had residents who automatically assumed it was applied, it should be applied here. An example would be the quarantine period. So COVID quarantine was 14 days initially, then it was reduced to 10 days, then 7 days. So even initially when it was publicly announced that it was reduced to 10 days from 14, we had employees and residents saying, yep, I'm done. And I had to explain, we're a different area, and our infections and the type of infections was still some of the past ones. And so even though their relatives and friends or people on TV, had a reduced quarantine period, I had to enforce the longer 14 days for a time until we saw a more prevalence of a new variant of COVID. And the same with from 10 to 7. And then even the comparisons with other jurisdictional counties, especially contiguous counties like Ottawa County and Kent County. And they would say, well, Ottawa County is doing this and Kent County is doing that. Again, we are a different community, and we're made up a little bit different than even a Saginaw that we might be the same size, but we have more rural. And so I try to approach it just by explaining and trying to educate and saying, affirming their concerns and affirming that, yes, that may be true over there, but we have to look at what's going on in our community at this time. And then I try to comfort them and say, we will get there. It's just, we're just not there right now.
And how much cooperation or working together is there between the counties in the state?
So we met regularly. We talked about best practices, but the Michigan Public Health Code, there's a health officer for every jurisdiction. So my jurisdictional authority is Muskegon County. And even though we meet and we try to determine what's the best approach, the Michigan law, gives me the authority to make that final decision. So we cooperate a lot. We talk about the science, the pros and cons. We, at the state level, MDHHS would set a lot of statewide guidelines that we would refer to and follow. And then at the federal level, CDC was our best resource.
All right. What innovations or changes made during the pandemic do you think should become permanent fixtures in public health practice?
I think the pandemic with the social distancing actually encouraged the use of technology, and even some of the virtual medical visits. We haven't used it as much as we should, and we're not where we should be with this use. But I think we should continue with that. The other side, on the population health side, I think it made people aware of like the hand washing and the potential germs and bacteria on multi-touch surfaces. So just because COVID has lessened, I think we should still be very cognizant of multi-touch surfaces and hand washing and just the communicable nature of some viruses and bacteria.
Hand washing is so important,
Yes.
and people forget that at times.
Yes.
As you look ahead, what are the top public health issues this community will face in the next 5 to 10 years?
Wow. We are so blessed with the Great Lakes, but there are concerns with contamination, even with PFAS is a big public health, I don't want to say issue, but a situation at this time. But then the self-care and the potential loss of services to our most vulnerable residents.
And that kind of leads to the next question. You are now navigating budget reductions. How has the landscape of public health changes How does it change for your department, or how has it changed in recent years?
So the obvious first change, of course, is the funding related to COVID and COVID outreach. And so it wasn't specifically said, hey, take this funding and treat COVID. It was we were able to use that funding and build relationships with grassroots organizations that our residents trusted. So one of the things I recognize is that, saying we're from the government and we're here to help doesn't always work. And we understood that even with social media, some of our residents, they work in groups and they have trust circles. And what we were doing with our funding was identifying champions within that trust circle and educating those champions or public health ambassadors. And then they would help share messages and help reinforce some of the healthier behaviors. So we will, we have lost that funding. We will try to leverage these limited dollars by working with some of our bigger health and human service organizations to see if just we could together fund or just in kind some of these activities on a continuous basis.
What specific services or programs are at risk due to recent funding cuts?
So public health, we have what is termed categorical funding. And when they cut categorical funding, so they haven't said our WIC funding, which is Women, Infant, and Children's. That's federal funding passed through the state to local public health. Categorical, they have cut, of course, the COVID dollars. And then there are other dollars that's still at risk of being cut, but they haven't been specifically identified. We've been warned, like, cuts are on the rise or they're headed our way, but they have not specifically said, cut this group of funding as opposed to another group for us.
So you have to make those decisions.
I have to be very careful. So with my accounting background and being very frugal, being good stewards of taxpayers' dollars, I have to be very careful not to enter into a commitment or obligation with the understanding that this funding could be cut. So I may have, overcorrected on the other side when we have a vacant position. It's like, I'm not going to hire somebody from another organization to come into our department and then we have to cut. So we make do without that position. We just don't have that nimbleness where you can hire and then next week say, now you're gone. That's not good for our community either.
How do these funding changes impact your ability to respond to ongoing health concerns? And I'm thinking specifically opioid use, mental health, chronic disease, and currently vaccinations.
Yes. It does limit it, of course. And I guess the I don't know if I want to say the saddest part, but the most concerning is that we have vulnerable population. We have individuals with accessibility limits, and specifically the elderly, the rural residents, and some of our youngest population. We also have an ongoing crisis of suicide among our teenage and young adults, and limiting that resources to address those items actually limits the ability to give somebody that personal care. Our residents' background are all different, and there's not a cookie-cutter recipe to address certain issues that impact the mind and the soul, I say. Sometimes you really have to get to know them and try to manage the best approach. And so when you limit funding, they sort of put us in a situation where we have to come up with a recipe that's efficient and just say, okay, most people fit this 60% situation, so we're gonna deliver services based on this 60%. Unfortunately, our most vulnerable fall in the other categories, and that's where we're we don't have the resources to focus or give that special custom attention.
That brings to mind a question. One back long ago when I was in nursing school, I did public health nursing.
Awesome.
And we went out into the community as nurses.
Yes.
Do people still do that?
No, not as much. No. We will go into the community if we have someone that has been tested positive for tuberculosis. We will go there to treat them so that they, don't have to get out. We will sometimes meet high-risk individuals for STI treatment. But for the most part, no, it's come here. And then we also encourage all of our residents to find a primary care provider or reach out to one of our federally qualified health centers. All of our local providers and federally qualified health centers are rated very high for quality. So we don't want our residents to do this episodic care where they wait until they have this one issue and then they want to get it treated or looked at. We do want that whole health, and the best place is to find a primary care provider.
Excellent advice. You've touched on this a bit, but what do you wish the general public better understood about public health funding, how it actually works at the county level?
I wish they would understand that it is categorical funding, and it is so unfortunate where sometimes we have to announce that this program or this service is going away, and we have some people that really rely on those services, and they may not use a different service as much, and so they wonder, well, why don't you just do this or keep doing this and stop doing this silly stuff? And for some people, it may be, but for others, it is. I think another thing is our residents to understand that we all have different experiences and a different story. And I tell my employees, I said, my siblings, we have the same parents, we grew up the same, yet we're different. So if that's the case, we know that our coworkers or other residents may have different values, different approaches. And I don't know, something about today's world, people seem quick to judge or condemn. And I think one of the things I'd love for our residents to know, public health-wise, especially when I have to make a decision, is I give people grace that they want to do the right thing. And they may not know how, they may not have the resources, or they may not even know what the next step is. And sometimes people call and they report a situation that they feel like they need public health intervention. And they feel like I'm not moving fast enough or we're not moving fast enough. And we have to not judge as quickly. And sometimes people feel like, well, I gave you all the information. Well, we have to check and make sure that's all the information we need to make a decision.
Lots of good lessons in
Yes.
here. You mentioned this issue of, it seems to be increasing suicide among young people.
Yes.
Do you have resources to address that?
No, not really. So there are, again, almost just like homelessness and unhousing, there are lots of situations and conditions that may cause those situations. And it could be mental health, it could be substance abuse, or just a lot of adverse childhood experiences. A lot of that with mental health, we have an amazing county department, our Health West Department for Mental Health Services. But I'm not sure that we have enough to reach all the people we need to reach. The substance use disorder. There are opioid settlement dollars, and there are lots of organizations in our community that is taking steps to address. But again, it's probably more widespread than we understand. And there's that negative connotation that comes along with substance abuse disorders as well as mental health concerns. And I think, to me, it still goes back to that, pause on your judgment and let's help people before we judge them. And so I don't think there's enough. I'm not sure that there will ever be enough. The one good thing I can say about Muskegon County is that we are an amazingly collaborative group of health and human service agencies. And when there's ever a problem, we get together and we brainstorm and work together to try to resolve it. And even if we can't settle it or resolve it in its entirety, we try to hit our most vulnerable. And among all of our organizations, we see who's the best fit to address this. And then the rest of us try to support that organization that's best suited to address those issues. And so we think we're getting a bigger bang for the buck that way.
I think so. And I think Muskegon County has received a lot of recognition for exactly that,
Absolutely.
for the collaboration
Absolutely.
that goes on.
I am so glad. Of all the places I could be a health officer in Muskegon, in the state of Michigan, Muskegon County is just the number one, would be my number one choice always.
We talked just briefly about vaccinations, but in the current climate, how are you addressing the reluctance of people to particularly getting children vaccinated?
Really difficult. It is so difficult to counter information, misinformation, or information that, or even situations or experiences that people have and post on social media, because we can't be everywhere to counter it. It's a major challenge. I don't know that we are doing it to the best of our ability, because there's so many different sources of information. And, by the time we learn, like Facebook, they've moved on to something else and we don't even know what that is. It's very challenging, and similar to cannabis and marijuana use. And so we have a quick phrase for that. Just because it's legal doesn't mean it's safe. And we got to come up with something a little more succinct of a message for vaccinations, and understand that people are different, and there will be situations and circumstances, but we're trying to look at it on the bell curve, from the biggest, like what's best for the greatest population.
As a Rotarian,
Mm-hmm.
you are obviously quite aware of the eradication of polio effort that
Absolutely.
Rotary, the World Health Organization,
Yes.
and the Gates Foundation had
Yes.
made. And now there's such a reluctance about getting vaccines. Polio is making a comeback in
Yes.
places.
Yes.
Measles, obviously,
Absolutely.
everywhere.
Yes. So
Tuberculosis, it's scary.
that is very scary. So there are a number of diseases that we felt was eradicated across the world, or at least, just that close, like Bill Gates
Right.
would say. That's going in the opposite direction. And
It's very concerning.
it is concerning. It is concerning because we've made great progress with health, population health. And now we may be going back the other way. Yeah.
Not good.
Yes.
Well, with that, what advice would you give to future public health leaders, especially people entering the field now?
I would say stay encouraged, and that it is a challenge, but it's also an opportunity to serve and to help, and stay encouraged. There are a lot of people, and I like to say most people want to do good, and most people want to help or not get in the way of others being helped. But sometimes people could be saying the same thing and disagreeing. And it's having that patience and optimism to just keep going And I say stay encouraged, but get in public health, stay in public health, because we really need you.
Yes, that's true. Anything else you would like to add this morning?
Well, thank you for being a public health nurse. And thank you just for the opportunity. I think this is a great outlet, a great way to reach. And I think if we are challenged with funding and getting our message out, that these type of sessions is another way to help. So thank you.
Well, that is the intent. And thank you very much for being with us today and for this enlightening conversation. That concludes our time with Kathy. I'm encouraged by what you have said.
Thank you.
Thank you all.